What causes a runny nose in cats and what to do? Have you ever noticed your feline friend with a runny nose and wondered what might be causing it? A runny nose in cats, also known as nasal discharge, is a symptom rather than a standalone illness. It usually indicates irritation, inflammation, or infection in the nasal tissues. Let's break down the possible causes and what you can do about it. One common reason for a runny nose is an upper respiratory infection. These infections are particularly prevalent in kittens and cats with weaker immune systems. They are often caused by viruses like feline herpes virus or calicivirus, but bacteria can also contribute. If your cat has a runny nose along with sneezing, a discharge, or fever, it might be a sign of a URI. Another cause could be allergic rhinitis. Cats can develop allergies to things like pollen, dust, or grass. This can lead to inflammation in their nasal passages, resulting in a runny nose and sneezing. Fungal infections are another possibility. Certain fungi, such as Aspergillus and Cryptococcus, can infect the nasal cavities. This can lead to discharge and, in some cases, neurological symptoms. Nasal polyps, which are benign growths in the nasal passages, can also cause discharge. These are more common in younger cats and typically result in discharge from one nostril along with sneezing. Sometimes, foreign bodies like plant material can get stuck in a cat's nasal passages, causing irritation and discharge. Dental disease can also extend infections from the teeth or gums to the nasal passages, leading to a runny nose. Injuries to the nose can cause inflammation and discharge, and while less common, nasal tumors or cancer can also result in persistent nasal discharge. So, what should you do if your cat has a runny nose? First, monitor your cat's overall health. If they are eating, drinking, and behaving normally, you may want to observe them for a few days. Minor infections or allergies can sometimes resolve on their own. However, if the runny nose lasts more than a few days, worsens, or is accompanied by other symptoms like lethargy or loss of appetite, it is time to visit the veterinarian. They can perform a physical examination and may use nasal swabs or imaging to determine the underlying cause. Treatment will depend on the diagnosis. Viral infections often requiring supportive care, while bacterial infections may need antibiotics. Fungal infections will requiring antifungal medications, and allergies might be managed with antihistamines. If nasal polyps are present, surgical removal may be necessary. You can also provide supportive care at home. Using a humidifier or taking your cat into a steamy bathroom can help loosen nasal mucus. Gently wiping their nose with a warm, damp cloth can keep it clean and comfortable. To prevent future issues, keep your cat indoors to limit exposure to infectious agents and allergens. Regular veterinary checkups and vaccinations are essential to keep your cat healthy. Using low dust, unscented litter, and avoiding strong perfumes or cleaning products can also help protect their nasal passages. By maintaining a clean environment and being attentive to your cat's health, you can help reduce the risk of a runny nose and ensure your furry friend stays happy and healthy.